Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient is a returning patient. It's none other than King Baratheon, back again from episode 17. Now before we start, if you haven't subscribed already, please do hit that subscribe button down here. Back to the video, completely blocked off right ear here. A large size Zollner is being used, which attaches to the majority of the wax blockage, and out it comes so easy. And here's a still shot of it together with a thick tragus hair attached here, which is actually embedded in the wax, probably because it's been snipped by the patient and it fell into the ear, getting stuck in the earwax blockage. In to get the remnants which didn't attach to the large extraction, and the first part comes away beautifully. Some keratin and residues on the other side. It does take a little bit of cajoling to come off, but it does eventually listen to me. Straight into the tube. Using a smaller suction here to get that thick hair as well as some of the residue. And it attaches. There is something a little bit unusual in King Baratheon's ear, which you may have noticed. He has small vellus hairs that extend deep into the ear, just here. We don't usually see these as far down into the ear canal. They're usually at the entrance of the ear canal, the first third of the outer part. But I think probably due to operations of polyp removal which he's had, perhaps the skin producing the hairs was somehow pulled over to cover the scarring as part of the healing of the skin. Either way, however it got there, it's very unusual to see. You can see here that the hair extends almost up to the eardrum. And we have a final shot of the eardrum here. Good job, I would say, and a normal looking eardrum. Now over to the left side. As I go in, you can see there is a red area just on the flap of the skin called the tragus. I've asked King Baratheon to keep an eye on this and see the GP if it gets any worse or it doesn't go away. It certainly wasn't there at his last procedure and looks like a bruise to the skin of some sort. I go in with a fine end and some chopsticking or fighting of space by the Zollner and the endoscope end. A better angle here, but because the wax is so soft, it just gets hoovered into the probe until we get to the more drier part of the blockage, which comes away beautifully. but then most of it gets sucked in, as well as it's pretty soft, so not much remaining on the end of the Zollner still shot here. Here you can see we have the same solitary thick one tragus hair problem in the ear canal, and I want to remove this. There is one at the entrance too, but clearly it wants to stay there, so I oblige and I go for the easy one in the background. So I go in for attempt number 2, and I could have easily used a hook of some sort here, maybe a rosin inserter, but my choice of instrument was the microsuction Zollner, and it goes straight into the tube. And here we have a final shot of the eardrum, looking good and no problems here. Please keep watching, subscribing. Ask me any questions in the comment section if you'd like to know something specifically. I will always try my best to answer it personally. Thank you so much. It's peace out from me, and I will see you in the next one.